Hi guys. For those of you who don't know me, my name is Winnie. I was diagnosed with diffuse large B cell non-Hodgkin's lymphoma back in November of 2018. It is now November 2019, and as you can see, I am doing a lot better. Um, So this video is basically for information for anybody who's looking for it or just curious on the particular type of chemo protocol that I had, which was R-EPOCH. I had dose adjusted R-EPOCH, and so that means you have a certain concentration of the drug, and depending on how your body handles the drugs, they'll either give you more, so a higher dosage, or a smaller dosage. And so they have 5 dose levels, I think, that you can go to. So you're gonna start at dose 1. So for this particular chemo, it is given intravenously for the most part. One of your drugs is given orally, and it is given over the course of 96 hours. Yes. So you I had 6 rounds of it for the type of lymphoma that I had. I was stage 4. I was basically at the last stage of that disease, and so my cancer was very aggressive, and I needed a very aggressive chemo protocol. And so this um, protocol is hard on the body, but that's what it took to save my life. So I had 6 rounds, and you basically go in for a week because they say it's 96 hours, but it's not really 96 hours. That's on a good, uneventful, nothing happens. And everything goes exactly how it should. You will be in there 96 hours. And so I was never there 96 hours. I always was there longer. So I would usually be in the hospital anywhere between 6 to 7 days. So, what's the chemo protocol like? So the name, most chemos, depending on what the drugs are, like the regimen has a nickname based on the names of the drugs, or it's abbreviated for the names of the drugs or the cocktail of drugs. So the drugs that I had were Rituxan, etoposide, vincristine, doxorubicin, um, Cytoxin, and a steroid, prednisone. So the first 5 I would get like in an IV intravenously, and the prednisone I would have to take orally. It was in a pill form. Um, so when you go in to the hospital, they're gonna start you on some pre-meds. So the pre-meds are to help you or reduce the risk of you having an allergic reaction. I did have a reaction my first round to the Rituxan because the Rituxan is a mouse antibody, so um it's a foreign genome, like it's a DNA or whatever that is foreign to our body, human DNA. So I had a reaction how I had a reaction the way your immune system would react when something like that is coming into your body. And so the pre-meds help with that. So the first round I had to actually stop. They had to stop the Rituxan for a few hours. They had to give me the more of the pre-meds and like IV Benadryl and stuff to like stop the reaction. And once they got that under control, we started the Rituxan again, and I was fine. And every subsequent round I didn't have a reaction. Okay, so they do the Rituxan. That goes for about a few hours. I think it's like an hour. It's really quick when that one goes through. Then they start to hang your daily bags. And so the daily bags are the doxorubicin, the vincristine, and the etoposide. And so those bags are supposed to run for 24 hours. But usually my bags would be overfilled, and so they would run a little longer than 24 hours. And like every 2 to 3 extra hours that those bags would run longer than they're supposed to would add up to the time that I would have to stay in the hospital. So after those bags finish, they hang a new set of bags and they continue this over 4 days. So at this point, you've been in the hospital 5 days. Then they finish it off with Cytoxin, which Cytoxin goes through about an hour or 2 hours or whatever. Once the Cytoxin is done, then you're finished. That's the end of the chemo. But depending on the dose of Cytoxin, then they may need to give you a chemoprotectant after, called Mesna. And so Mesna runs for 14 hours. So you do the math. You've been in the hospital about 7 days at this point. So, well, yeah, at least 6 to 7 days. That's if there's like no reactions or anything weird going on, no overfill bags, like nothing extra. You're in the hospital for a long time. So during the chemo, what kind of symptoms are you having? I lost every single piece of hair on my body, even like in my nose. That was like really weird to me. After the first round, like a week later, all the hair on my head just started coming out in clumps. Things like your eyelashes and stuff, like they took a little longer to come out. But everything else just shed really quickly. I was bald and looking sickly real quick. It changes the color of your skin and stuff because of the toxicity. Like I turned very dark. My feet were really, really dark. That bothered me. Your nails and stuff are going to be black and brittle and splitting, and they will come apart from the nail bed if you don't like take care of them. So get some treatment for your nails. Toward the middle of my rounds, as I got like higher dosages of the medicine, I would start to get mouth sores everywhere. Even in like my nose and my esophagus, I had sores. That is bad. Like it's very hard to swallow air, less known food or drinks or anything. It dries you out, like it makes your digestion really slow. Like you may be constipated for a week dealing with that chemo. Of course you're nauseous, you can't really eat anything. For women, it destroys our reproductive system. My period stopped pretty much, I guess, like after the second round of chemo, and I have not seen it since. It's been about 6 months since I stopped the chemo, so all in all, I haven't had a period in about 10 months now. With that, your body is basically premenopausal, and so you start having hot flashes and all these other symptoms that a woman in menopause would have, because you don't have the hormones and stuff that you used to. Your body thinks that it's in menopause. What else? The fatigue is a big one. That's one common pretty much for any type of chemo that you're on. Like it makes you tired. The level of tired though is like if your house was on fire and you know you need to run and get out, but your legs just refuse to work. That's the level of drain it is. Like you cannot lift your head or blink an eye even if you wanted to. That's how drained you are. And that fatigue will persist after the chemo. It can persist for at least a year with this particular protocol. It could be shorter or longer, just depending on the person, but my doctor has specified that it takes at least a year on average for everyone. With the premenopausal symptoms, the hot flashes were really, really bad. Like it's hard to sleep. You do have pain, and that pain persists like after the chemo. You have scar tissue pain, even though the chemo is not surgical. It does destroy like your nerves, and that gave me neuropathy in my hands and feet, so numbness in my hands and feet. And that went away, I guess about a month after the chemo stopped. That's when my hair and all that stuff started growing back. And the nerve pain is persisting though. Sometimes I still feel pain, like where my original tumor was in my chest. I had other tumors, but I can feel that one like real prominently. Sometimes it just hurts. Other pain that you may have, bone pain. That particular regimen, since lymphoma is in your blood or your immune system, basically your whole body, like it's very it's a systemic type disease. Your chemo is gonna kill everything, every single thing in your body. They can't target one specific thing with this chemo, since the cancer is basically everywhere. And so when it kills everything, it kills the nerves, it kills your white and red blood cells, everything that you need to fight off infection. And so with that, you can't get sick. If you get sick, you could die. The common cold could kill you while going through that type of chemo. And so after I finished the chemo, I unfortunately did get sick. I guess about 6 weeks after I finished the chemo, I caught a cold, and it feels worse than the flu. So when you do get sick post chemo, or if you're unfortunate enough to get sick during the chemo, like the severity of it is so bad. Just don't get sick. So you do have to walk around with a mask. If you leave the house or anything like that, just to protect yourself. With that, you are also on like antiviral medication, antibacterial medication, antifungal medication. Any kind of organism that can attack your body, you got some kind of prevention for that, some kind of protection. It doesn't protect against everything, but the most common ones, they got you. What else? So yeah, you're taking a lot of medicine around the clock. You take those. You have to take anti-nausea medicine around the clock, because I stayed nauseous. Like it was like it never stopped. You take pain medicine because you may be experiencing pain. That last day of chemo, they also give you like an injection that's supposed to help boost your immune system back up. And so with that, it's basically boosting your white blood cells. Your white blood cells are made in your bone marrow. With that boosting like that, medically induced, it makes your bones hurt because they're so inflamed trying to pump out all those new white blood cells that it's making. And that pain is the absolute worst. But I have found that taking Claritin like the day of and a few days after really helps with that. Other than that, I think those are pretty much all the main symptoms that I can remember. You have a whole host of stuff going on with you during the chemo and after the chemo. So, I mean, if there's anything else that you can think of that maybe you have questions about, just let me know. But that is my experience. I hope that this has helped somebody and been informative at the least. Thank you and have a good day.